Hi, this is Philip Ador, founder of NCLEX RN 45-Day Challenge. In this video, I'm going to be talking about renal calculi. Renal calculi, kidney stones or urinary stones have many names, including urolithiasis, which is actually formations of stones along the urinary tract, or nephrolithiasis, which is stones forming specifically in the nephron or kidneys. To make things even more confusing, urinary or kidney stones can also be called renal calculi. Calculi essentially means stones. However, these words are used interchangeably but essentially mean the same thing: kidney stones. In order to understand kidney stones, we have to revise the anatomy. Here, the adrenal glands, which are the endocrine glands, sit above the kidneys. The kidneys form the urine. Urine will then travel down the ureters and be stored into the bladder. The bladder can stretch, and once full, we urinate. The urine will flow through the urethra and then out. The ureter has three sites of constrictions, contracts smooth muscle. And these are important to know because these are the sites where the narrowing can occur, and also the sites where urinary stones can lodge. The sites of urinary constrictions include the pelvic ureter junction, the pelvic brim, and the vesicular ureteric junction. The vesico-ureteric junction is actually the connection between the ureter and the urinary bladder, which is sort of behind and under the urinary bladder. The kidneys are organs responsible for filtering the blood and disposing of waste. It is important for regulating blood pressure and regulating electrolyte balance. It is also responsible for producing some important hormones such as erythropoietin and activations of vitamin D. Here is the adrenal gland, which are again the endocrine glands that sits above our kidneys. Here is the ureter. Looking inside the kidneys, it consists of pyramids called medulla pyramids. Surrounding the medulla pyramids is the cortex. The medulla pyramids joins the tip of the medulla pyramids joints and forms the calyx. The calyx then join together and form and drain into the renal pelvis. The renal pelvis has a renal artery and renal vein entering and exiting. Residing around and within the medulla pyramids are the functional units of the kidneys called nephrons. Nephrons are structures which filters our blood. They secrete waste and allow reabsorptions of things into the bloodstream. Thus, it has a main role in regulating electrolytes and fluid balance in our body. And then we have the efferent arteria leaving the glomerulus. Once filtering has occurred within the Bowman's capsule, the filtrate will travel along the tubule of the nephrons. Firstly, it will pass the proximal convoluted tubules. Then it will go down towards the loop of Henle, the distal convoluted tubules, and then finally to the collecting ducts. Looking more closely at the tubules, the cells that line the nephrons, tubules are predominantly cuboidal epithelial cells. Within the tubule of the nephrons is the crystal-like structures can fall. The crystal-like structures are essentially precipitants of some electrolytes that have accumulated there. This crystal is actually a urinary stones. If the crystal is small, it will just pass into the urine. But if it remains in the kidneys, in the nephron, it can grow bigger and become a kidney stones. A kidney stone again is basically a big crystal. A kidney stone can lead to an obstructions. The obstructions within the tubule can create a buildup of pressure in the tubules. The pressure can cause irritation, and this irritation is read by the brain as a renal colic. There is also an inflammatory process going on due to the obstructions, and this also leads to a renal colic. The pain we feel when there is a urinary stones in the body. Alternatively, the urinary stones can lodge or get stuck with the ureter. To remember the sites of the constrictions of the ureter, the stones can get stuck there, and when it happens, irritations and pain can occur due to the stretchings of the fibers that are there, which are caused again by the increase in pressure within the ureter. With this increase in pressure proximally to the site of obstructions and with the irritations going on, edema can occur, and the ureters will contract more vigorously, trying to push the stones out. This is called the hyperperistalsis, And so with this in mind, the clinical presentations of the kidney stones can include acute flank pain, which can radiate to the back, towards the groin, and to the flank. There can be associated fever because of the inflammations, and nausea and vomiting. There can be also urinary frequency and urgency. Hematuria, the person may present to be obese. The risk factors for developing a kidney stones include the high protein diet, high salt diet, male, Caucasians, obesity, and dehydrations. Medications including antacids and carbonic anhydrase inhibitors. Sodium and calcium containing medications also increase the risk of developing kidney stones. Crystal urea is also a risk factor as well as having a family history. These risk factors will lead to a number of things. First, some of these risk factors will increase the urinary solute concentrations, including concentrations of the calcium, uric acid, and calcium oxalate, and sodium. Some of these risk factors will also decrease the stones forming inhibitors, which include the citrate and magnesium. The increase in urinary solutes and the decrease in urinary stones inhibitors causes urine supersaturations, leading to urinary crystal formations or urinary stone formation. A decrease in urinary volume, such as in dehydrations, and an excessive increase or decrease in urinary pH also contributes to the urine supersaturation. So, in summary, urine supersaturations with the stones forming salts results in the crystal formation. And as I mentioned, there are a lot of types of urinary forming salts such as calcium, uric acid, and oxalate. And because of this, there are many types of kidney stones. The stone pathology can be broadly divided into 5 different types. This includes calcium oxalate stones, which makes up the majority of like 75%. There is also a calcium phosphate as well as the Steve light is common in chronic urinary tract infections. Investigations for suspected renal calculi, renal stones include the full blood count, CRP, magnesium, calcium, phosphate levels, urinalysis which may show hematuria, a 24-hour urine, calcium levels, phosphate, level oxalate, urate, cystine, and Sambian levels. And this can show us what type of kidney stones it might be. X-ray can be performed to detect the kidney stones. Ultrasound may also reveal hydronephrosis if the obstructions is within the ureter causing backflow of urine, which will dilate the ureter proximally. Finally, a CT scan can also be used, which can show kidney stones. Let's look at the algorithm again. The clinical presentations of kidney stones include fever, nausea, vomiting, acute flank pain, radiating to the groin or to the back. The pain is often described as stabbing and severe, and there is tachycardia with or without hematuria. The triad of urinary kidney stones, some say is fever, vomiting, and acute flank pain. So in acute setting, analgesia is given with or without an antiemetic to prevent vomiting. IV fluids are administered carefully. Most urinary stones, if small or less than half a centimeter, will pass spontaneously without any interventions. However, if interventions is required, it is either done electively or as soon as possible. By interventions, I mean surgical management, and surgical management will depend on how big the kidney stone is, as well as where the kidney stones is, if within the ureter or within the actual kidneys. Percutaneous nephrostomy allows placement of a small, flexible rubber tube of a catheter through the skin and into the kidneys. And this is in order to drain the urine out if there is a signs of obstructions. This is more of a symptomatic relief in terms of the removal of the kidney stones. There is a ureteric stent insertion. Here is the ureter, and let us say the stone is lodged within the ureter. A stent, a rod can feed up through the urethra, through the bladder, atop the ureter at the side of the obstruction. And the stent can be placed there, and the stent will be allowed to drainage of the urine. Essentially, bypassing the blockage, urine can then just drain straight into the bladder. If the urinary stones is within the kidney, a procedure called a percutaneous nephrolithotomy can be performed. In this procedure, the aim is to remove the stone from the kidneys by a small puncture wound through the skin. It is most suitable for the removal of the stones that are more than, let's say, 2 centimeters in size, and which are present around the pelvic regions of the kidneys. Another surgical procedure that can be done for urinary stones within the ureter or within the kidneys is a simple endoscopy procedure that will break down the stones within the kidneys or the ureter. Alternatively, there is open surgery to remove and break the stones. Finally, there is the extracorporeal shockwave, lithotripsy, which uses the shockwaves to break up stones that form in the kidneys to enable easy passage of these fragments out of the body within the urine.